Hi, everyone, and welcome to this episode of Thinking It Through with Dr. Naidoo Child Psychiatrist. Today, we are speaking with Dr. Jacqueline Eskew. She is a clinical assistant professor at the University of Arizona and currently the co director of APAL, the Arizona Pediatric Psychiatry Access Line, which she will teach us all about in this podcast episode. So, Dr. Eskew is an experienced child and adolescent psychiatrist, and she's working at the Banner University Medical Health Center, South Behavioral Health Clinic. After finishing medical school at the University of Arizona, she completed her general psychiatry residency and her child and adolescent psychiatry fellowship at the University of Pittsburgh Medical Center in Pittsburgh, Pennsylvania. There, she served as a chief fellow for her child psychiatry fellowship. I did too at LIJ. Um, and she completed an additional fellowship in public service psychiatry. That is super cool. And has additional training in women's mental health care as well as in healthcare administration. So Dr. Eskew has done many, many different subspecialties in psychiatry. She is really passionate about increasing access to quality mental health care, especially for teens and for children. In her clinical practice, Dr. Eskew sees the value of working very closely with pediatricians and primary care providers in the community to help collaborate with their education, resources, and treatment recommendations. So, as the co director of APAL, Dr. Eskew continues to be at the forefront of forging new paths to help provide expert behavioral health support for our frontline primary care providers across the state of Arizona. She is a pioneer in this field, and Dr. Eskew and myself are working on an initiative to help meet the need for mental health care in Arizona's youth through helping with other organizations to build Arizona's very first pediatric mental health care access program, of which APAL is a very important component. So, here to speak more about this initiative is Dr. Jacqueline Eskew. I just called to say I'll help you being a pal to pediatricians with Dr. Eskew. Thank you so much.
Oh, thank you so much for the warm welcome. I'm really excited to be here.
Yeah. Is there anything else you wanted to add in your training or experience that I was missing?
No, I think you covered it all.
All right. So, you are a child psychiatrist. Tell us a bit about your journey to med school, child psychiatry, and then to this incredible position.
Yeah, so my interest in psychiatry actually started in high school. I took a psychology class, and it was my favorite class ever. I had an amazing teacher. Teachers, make all the difference. And she was also a clinician, a therapist, and it just really got me excited about learning about the brain and hearing her patient stories, learning how she has helped others. Just really inspired me to go into the mental health field. And so in college, I went to Barnard College in New York City and I studied psychology there and then also did my pre med requisites because I started to think that psychiatry might be the perfect way to combine all my interests. And then I came back to Arizona, where I'm from, and worked for a couple years, and then started at the University of Arizona College of Medicine in Phoenix. And when I got to med school, I was like, oh my gosh, every field is so interesting. Like, maybe I'm not sure what I want to do. This is all so cool. But as soon as I started my third year clerkship and did psychiatry, I was like, this is absolutely the field for me.
Mhm.
Really just love the time that you get to spend with patients and really getting to know patients on a deeper level and addressing their health more holistically. And I also really liked working with kids and families on my other rotations. So I wanted to figure out a way to combine that with psychiatry. And I got to do a really cool away rotation as a fourth year on an inpatient adolescent unit at Bellevue Hospital
Oh,
in New
very cool.
York. Yeah, it was so cool. It was just really rewarding to work with teenagers, really interesting and fun. And I also just really appreciate the team-based care that you have when you're a child psychiatrist. So in order to, I think, have the most successful outcomes, like you really have to work as a team. It's not just you and the patient, it's you, the patient, their family, their therapist, hopefully their school, and often their pediatrician. And I just really loved that aspect. So after med school, I matched at UPMC, University of Pittsburgh, and I did their combined child track program. So 5 years, you do your general adult psychiatry residency and your child and adolescent psychiatry fellowship. And they just have a really awesome and big child psychiatry department. So I got to learn from so many experts in all different areas and just really solidified that this is what I wanted to do. And then after graduation, I knew I wanted to come back to Arizona, where I'm from, be closer to family, and really serve this population. And knew that there is such a huge need for child psychiatrists here as well. So I started working at the University of Arizona in Tucson, and I met Dr. Zaira Kalia, who had launched the perinatal psychiatry access program and was looking to work on a pediatric version of the same program. And so we've been working together to launch this program, and that's where we are today.
Awesome. So cool. Um, you spoke about the need within Arizona, and tell us a bit about the need.
Yeah, absolutely. So I think it's both the combination of the growth of child and adolescent mental health concerns and then the shortage of experts who treat those concerns, particularly child and adolescent psychiatrists. And it's certainly not just an issue for Arizona. It's, really a nationwide issue, but Arizona is in what our organization ACAP calls a severe shortage state. So we have 11 child and adolescent psychiatrists per 100,000 kids in the state. When it's estimated to actually meet the current needs, we need like more than 46 child and adolescent psychiatrists per 100,000 kids. So we're way below that number. We, at least from the most current numbers, have a total of 176 child and adolescent psychiatrists in the whole state. And that doesn't really look at who's actually practicing right now and who it takes insurance and what availability everyone has. So this is really a severe shortage for our state in particular.
What are some thoughts about how come there is such a shortage? What are some factors that kind of, because this shortage has been going on, us in psychiatry, we know this has been going on for a long time, right? Before we joined as psychiatrists, but it
Yeah,
seems to be getting bigger and bigger. So, what are some factors that really precipitate and perpetuate these issues?
yeah. So I think the bigger and bigger issue relates back to the growth of the concerns and how much increase we've seen in concerns related to children and adolescents. And then I think there's also some factors related to training, that the training to get to child and adolescent psychiatry is a little bit longer than other primary care specialties, which might in some cases end up deterring really awesome candidates for coming into the field and following up with that. I think, child and adolescent psychiatrists are working as a whole to come up with solutions, including maybe like just slightly shortening the training pathway to make this a more accessible career. But those are some of the things that I really think about as relating back to the shortage.
And, just for the listener who may not know about psychiatry or medical school or residency, to become a pediatrician, which is, a general physician that specializes in kids, it takes 3 years. So you go to med school for 4 years, then you do your 3 years, and then you can kind of go out and practice. There's more time if you want to become a specialist, but if you want to do kind of general pediatrics, it's 3 years. But to become a kind of a general child psychiatrist is really considered a specialty. So you first have to do adult psychiatry training, which typically is 4 years. But Dr. SQ shortened it because UPIT had a version where you could do it combined because you first have to do adult training and then child training. So you did it in 5 years, and then you can fast track, which means instead of doing your full 4 years of adult training, you opt out of that last fourth year and you do 2 years of child training. And there are other trainings like triple board, but really 5 is the minimum.
Mhm. Yes.
And I do think that it sounds like 2 years might not be that much of a difference, but it is when you're considering kind of paying loans and then age and then the balance of family life and work life, I think it really can make it harder to get enough people in the door. And then you need experience too. It's not just the training, but also the experience you get afterwards that you build up to really be able to be a helpful clinician.
Absolutely.
Yeah. Um, and is this shortage just with child psychiatrists, or are there shortages in other areas of mental health too?
Yeah, absolutely. So the perinatal line that we have is addressing another shortage in perinatal focused psychiatrists. And then thinking about children specifically, like we also have a shortage of qualified, therapists too. Like it really spans the full gamut of treatment.
Yeah. So, are there unique challenges that we have here in Arizona compared to across the country? Because
Mhm.
I know ACAP, which we both belong to, which is the Professional Organization for Child and Adolescent Psychiatrists, the American Academy of Child and Adolescent Psychiatry. There are many states where there are shortages. Even New York is considered a shortage, which is where I'm from, and there are thousands of child psychiatrists there compared to where we are here. So, what are some unique challenges in the climate of mental health care here in Arizona?
Yeah. So one thing I think about is just like our distribution of the population. So we do have child psychiatrists in some of the most populated cities, Phoenix and Tucson are going to have like the highest concentration. But over 50% of our counties don't have one child and adolescent psychiatrist. So in those like more rural communities, the lack of care is even more massive than it is in the rest of the state. We have also, I think, been kind of behind the game compared to other states when it comes to some of these, statewide programs like our child psychiatry access line that other states have had these for 20 years in some cases. So, and we're just getting ours going this year. And so some of these services, the access in rural communities is a difference for Arizona compared to other states.
And I think other factors when I think about Arizona and working in Phoenix, I'm in Phoenix, well, not Phoenix, I'm in Chandler, but closer to Phoenix
Mhm.
than where you are, Dr. SQ, which is in Tucson, which is about 2 hours apart, I'd say, right?
Mhm.
Um, I think that there are a very large population of Spanish speakers here
Mhm.
since we are a border state. So I think that compared to where I've worked in New York City,
Mhm.
it does feel like there are a higher percentage of patients in that population. I
Absolutely.
also think that there are a lot there's that mixture of kind of rural and city. So I think
Mhm.
the education about mental health care and the stigmas I think against mental health care is different and unique here. I will say I'm curious about your training in if in Pittsburgh, if you felt there was some difference. But in New York City, when I did training, very rarely would parents come to me with alternative treatment. But here
Mhm.
in Arizona, I was surprised when I did started doing outpatient care, how many kids came on with crystals and essential oils, and that is a big deal here. Alternative medicine, complementary medicine is much more widely accepted here in Arizona. And I also think there's a lot more stigma against medication here too.
Mhm.
So I think that does affect our patient population. Um,
Absolutely.
and I
Absolutely. Yeah, I've seen the same comparison from my work in Pennsylvania.
and I think too, because there have been substance use issues in places of poverty, and Arizona
Mhm.
has lots of pockets of poverty. There are lots of intergenerational parents, grandparents raising kids, which I think is within every state, but I
Yeah.
really saw it much more here in Arizona, many more grandparents raising kids.
Yes.
Um, and of course, we have our Native American population as well.
Mhm.
So that has unique needs and cultural differences, as well as higher rates of substance use and suicide. So I think that's also another unique facet that we have here in Arizona, too.
Absolutely. And I don't know about your experience in New York, but I also have found that I get a little bit more pushback from schools here when I try to collaborate or implement like accommodation plans than I was in Pennsylvania. So maybe a little bit of stigma in some areas related to, incorporating mental health treatment into the school setting as well.
Yeah, I agree. I mean, in New York, I could advocate for adaptations without providing a diagnosis or information about medications, but here they want the diagnosis, they want the they want so much more.
Mhm.
And I also think it's because we have less. The teachers also have less. They
Okay.
consistently are the lowest or second lowest paid in the country. They
Absolutely.
are understaffed, and so I think that there are lots of challenges with that. So, as listeners may or may not know, because there are so few child psychiatrists like myself and Dr. SQ, a lot of the responsibility of caring for mental health care falls on pediatricians, which are primary care. So, what do you know of how pediatricians are trying to address this concern? What efforts are they doing? What struggles
Mhm.
are they having?
Yeah, so I definitely think it varies on the pediatrician or the primary care provider, but a lot of pediatricians I've spoken to who have an interest in this area have had to do just like a lot of their own education, seeking out conferences and continuing medical education opportunities to really try to just put those pieces together that they often didn't get as part of their formal pediatrics training. I know kind of coming in the works, there's likely going to be some more requirements in pediatrics training for mental health training, which I think is awesome and will be super helpful, but that just hasn't existed in the past. And so often it's really up to the pediatrician to do this all on their own time. And so in some cases, I think they will manage the symptoms as much as they possibly can based on the additional training they've been able to receive. And in other cases might be, referring out to mental health providers in the community. And that can just be really difficult because as we mentioned, the shortage, there's long waiting lists. Sometimes it's really hard to find someone that takes that patient's particular insurance. And so then they're kind of stuck in this waiting game where they have someone that really needs care, but also don't have the resources of where to send them.
Right. And, for the listener again, as if a child needs mental health care and for some reason they have to go into an inpatient psychiatric hospital for treatment, when they come out of that hospital, which may be for a couple of days or a couple weeks, usually in Arizona it's about a week or less. It's not typically more than that. Um, where I work in Rhode Island, it's 2 weeks or more sometimes, but because of the brief time they're in the hospital, oftentimes if they're started on medication or treatment, it needs to be continued when they leave. So because there aren't that many psychiatrists like myself and Dr. SQ, they end up going to the pediatrician, which sometimes can be really tricky for them because they may not be familiar with those medications, side effects, how they work, monitoring for effectiveness. Um, so it has become a really complex situation for pediatricians to handle.
Yes, absolutely.
So, how does APAL, what does APAL stand for? How does that kind of come to play with this challenge that we're seeing?
Yeah, so APAL is the Arizona Pediatric Psychiatry Access Line, and our role is a CPAP, where this is a model that, as we mentioned, was started 20 years ago, 2004, by Dr. John Strauss in Massachusetts, and really this model allows us to build a relationship with primary care docs and pediatricians and support them in caring for their patients that have mental health concerns. And so, really, the goal of the phone line is to support and empower our frontline providers who are seeing these cases every single day to feel confident and comfortable in managing these cases and providing really quality mental health care with our support.
And how does it work?
Yeah. So we have a phone number that is 1-888-290-1336. And right now we're open 12:30 to 4:30 Monday through Friday. And then in January we're going to expand to the full day that we're open. And the phone line is geared for the provider. So typically a pediatrician, primary care provider, they call the number, they speak directly to a clinical navigator who just gets a little background information about why they're calling. Clinical navigator is also an expert on resources available in Arizona. So if they have just a resource question, the clinical navigator can totally help them out with that. In most cases, they also want to talk to a child psychiatrist. So they are connected directly to the child psychiatrist. There's not like a wait time or needing to call back. And so, for example, like on a Tuesday, I staff the line in the afternoon. So if a pediatrician calls on a Tuesday, they'll be connected to me. Usually I'll ask them, like, how much time do you have? Because they're super busy, and they may be calling like on a free afternoon and they have lots of time, or they may be calling when they have like 10 patients waiting to be seen. So I want to be respectful of that. They tell me their concerns, and then I just offer them input, advice, ask more questions, try to help them clarify what they're going to do next. And then following the call, we also send an email with no patient information that just provides kind of a summary of what we recommended, and also usually some other information that like maybe we didn't get to this, but this could be helpful for the future when this patient comes back. And we send that to the provider so that they also have that to refer to in the future. The hope is really that when they make this call, we're not just helping with that one patient, but really providing some information that's going to be valuable for like all their patients going forward that might present in a similar situation.
I think it's really incredible that you also provide that kind of summary, because sometimes, just like with a patient, you're sitting there talking to them, it's hard to remember everything that's being said because I'm sure as a consult, you are providing lots of information that maybe the pediatrician may not have thought of. So it's great that those bullet points are sent to them. I think that's really cool.
Yeah, and then we can also send along like handouts that we think might be useful for the patient. We can send, suggested screening questionnaires if we think that might be helpful as a next step. So we can also just really directly provide those resources to the pediatrician who called.
So just to be clear, so is it anyone taking care of primary care? This could be a family medicine doctor, a pediatrician, an NP, a PA.
Absolutely. Yes.
What
Yep.
about, oh, go ahead.
I was just going to say, we also, I mean, we won't say no to anyone that calls, but we also are happy to talk to, people that are in the role of like a school nurse or even a therapist who might want some support with a complicated case. So it's really a wide variety of folks that the line is open to.
And what about therapists? What if a therapist has a kid and they can't get them in to see someone and they're concerned for them? Would that be someone I could call?
Absolutely. Yeah. And we can talk to them about, what might be the next best steps for them. Because we don't just talk about medications, we talk about level of care, screening, diagnosis, how to get school supports. So, absolutely.
And could, fellow psychiatrists or fellow psychiatric providers who don't maybe are new or just need another kind of second opinion, can they also call?
Yes, 100%. We'd love to talk to them. Absolutely. And trainees as well. So residents, medical students who are maybe helping take care of a patient, that's like a great job for them to call and talk to us, and what we'd be happy to give input and teach them something along the way.
So they have to be physically located in Arizona, though, right? The patient and the provider.
Yes. Mhm.
And I know a lot of pediatricians will see kids up to 25, sometimes even older if they know the family. Do you talk about those patients too, or is there a hard stop at 18?
We don't have a hard stop. So I think a lot of, issues that children and adolescents are faced with are similar to transitional age adults and kind of those young adults. And so absolutely we'll try to help with those cases too. No hard
And
stop.
is there a comparable adult psychiatry line in Arizona?
So the perinatal psychiatry access line is the one that I'm most familiar with. So that would be really any women's mental health issue, usually related to like, the peripartum or postpartum period, but could be any women's mental health issue.
Okay. But there isn't one that you know of for just general psychiatry for
Correct.
adults.
Correct. Not that I'm aware of.
Um, and for this call line, I'm curious, what are kind of typical things that pediatricians and primary care providers call about or psychiatrists call about? What are they most concerned about? I know it's still new and growing, but I'm
Yeah.
curious.
Well, it's really been a lot of things. Some of the questions that we get might be about trying to make a more complex diagnosis. I feel like I've had quite a few questions about like how do I know if this is bipolar disorder? And kind of working through that diagnostic pathway with those patients that maybe have a lot going on and it's really hard to narrow it down. Um, Probably our most common question so far has been related to psychiatric medications. So it could really vary though. In some cases, it's the first psychiatric medication that someone would be starting. The pediatrician often like has an idea of what they want to do, and they just want to run it by us, make sure that that plan kind of makes sense to us. Would there be anything else we would think about in the case that might lead us to a different medication? And other times it might be something that's a little more complex. Someone has tried and didn't do well with like multiple medications, and now the pediatrician is really wondering like, what do I do next? Also, a lot of questions about like side effects and like unusual side effects. Have we seen this? What would you do to manage this?
Hmm. Yeah, I mean, it's so hard. I think pediatricians have a really, really tall order to do all the general stuff and then have to do mental health too. I think it's really tough.
Super, super challenging. So we really want to just be like warm and supportive so they can feel good with the decisions that they're making.
And you mentioned that you are on the line on Tuesdays. Who are the people that staff this line? Who are the people answering the call besides the clinical navigator? That sounds like the pre-person, right? Like they are screening and getting information before they come to you.
Correct. So that's the pre-person as a clinical navigator, and in most cases, it will be Megan or Sarah that you talk to, who are both awesome. And then they will connect you directly to a child and adolescent psychiatrist. And so there's a couple of us that staff the line. Myself and Dr. Jennifer Tran are located in Tucson, and then Valleywise is actually and DMG are also helping us staff the line in Phoenix. And right now, Dr. Corey Nielsen is taking a lot of those calls when it's not myself or Dr. Tran.
Okay. And I know there are a lot of people that provide pediatric mental health care, especially with the shortage. There are several mid-levels because there aren't psychiatrists like us. Is that a part of the model that you talked about that Dr. Strauss developed, or why is it important to have it staffed by a child psychiatrist?
Yeah, so the model is really that the pediatrician or primary care provider gets to talk directly to a child and adolescent psychiatrist. And that's really because child and adolescent psychiatrists are the experts in this field. And that's what we're looking for here, is being able to have that consultation with an expert who's had the most education and experience when it comes to treating child and adolescent mental health concerns.
And, how do you feel that this is filling the gap for mental health care? How is this line helping with that?
Yeah, so I think because pediatricians are really the front line, they're faced with this, and this is really hard. And so if we can do anything to make it easier for them to actually keep these kids in their practice, not necessarily always have to send them out, but feel really comfortable about taking care of these kids who probably already feel really comfortable with their pediatrician and like already have this great relationship with them. I think that decreases the likelihood that they're going to need to send somewhere else where there's going to be a long wait. It decreases stigma because you're getting that mental health treatment right in your pediatrician's office, which I think is really awesome. And some cases they might still need to have a referral out process, maybe a really complicated case that just needs to see a child psychiatrist long term. And we can help make a difference in that time when they're waiting for that process so that the kid is not just sitting there not getting the help that they need.
Right. And I think that's a really important point that you make, Dr. Eskew, about staying with a provider that they know. So, in my experience, I've worked in outpatient care for over a decade, and right now I work at a partial hospital program, a PHP, which is, for the listener who may not know, is between a higher level of care, like an inpatient psychiatric hospital, and they're stepping down to clinic or outpatient. Or they went to an emergency room with a crisis and they're trying to avoid an inpatient hospital, so then they come to us. So in my years of talking to pediatricians, so often they're so relieved to talk to a child psychiatrist to get our thoughts and really, it's more so reassurance. It's very rarely I've talked to a pediatrician who has no idea. Most often they have a very clear idea, but it's just out of their comfort zone. But on
Mhm.
the perspective of the parent and the patient, So often they don't want to see a psychiatrist after. They just want to go back to their pediatrician because they have known them for so long. And one of the things that I think is such a benefit of having a pediatrician who's comfortable doing behavioral health is because they know that patient from a longer period of time, oftentimes pre being mentally ill. They have
Mhm.
so much valuable history and they have an alliance with the family. The family already trusts them. It is very different to have a pediatrician who can speak to you on a level that's seen you, through toddlerhood and young adult, preteen, and now young adult, and be able to help you understand more about your mental health and wellness than someone brand new like me. It's a different kind of relationship. So
Exactly.
I can, again, it is a tall order, but I definitely see lots of value with keeping patients with the provider they know because we
Mhm.
know in mental health care, so much of the progress of mental health has to do with trust. If you do not trust the person that you're working with, whether it is as a therapist or a psychiatrist or a counselor, it is really hard to progress. You have to have that trust, and pediatricians have that built in with their work.
Exactly. Yes.
So, let's say in the current climate that we have, since we don't have many child psychiatrists and psychiatric providers, what would you advise for parents and young people that are seeking mental health care for themselves?
Yeah. So I think number one is don't let that shortage like deter you from seeking treatment, right? So I don't want people to wait just because they've heard that there's a shortage. I think starting with the pediatrician is a really awesome place to begin, especially with having the APAL line in place and knowing that that's an option that they can reach out for help. If you are, meeting with a specialist in child and adolescent psychiatry, then I think just really wanting families, both kids and parents, to feel empowered to ask questions, ask what kind of training that the provider that they're seeing has and experience, especially specifically in treating kids and teenagers. And don't feel concerned about asking questions about your treatment plan. Like, you should be able to know when you leave, like, these are the risks, these are the benefits, these are the alternatives, and really feel good about that treatment plan when you leave. So I guess overall, don't wait. Definitely seek treatment and know that you totally should feel empowered to ask questions and make sure that you feel comfortable with the plan before you leave.
And now with new mental health care regulations, medical insurance plans should be covering mental health care, issues as well,
Mhm.
in equal parity. So I also encourage parents to use their insurance, call the back of their insurance card, call that number, and they're required to give you three providers in network who take your insurance. And
Yeah,
then at least from there, you have it documented that you called the insurance company, you told them there's a concern, and you can follow up with someone that's within network. And then you can always report back to them if that does not seem to be progressing. And then maybe they can even help you find somebody that's within network. Um, but it is a challenge, and you do have to be persistent and patient. And that's
yeah.
why it's always better to get ahead of the curve than wait for a crisis.
Absolutely. And, your pediatrician can also be a great source for referrals for, therapists and child and adolescent psychiatrists. Also, I utilize psychologytoday.com a lot as well, where you could search for therapists in your zip code that take your insurance as well. So there are a lot of resources to use. Use them.
And this podcast mainly is focused on educating parents about awareness, mental health awareness. So let's think it through. Let's say that I am a parent and my child is being cared for depression by their pediatrician. They've been in their care for a long time. I really love the pediatrician, but I really feel like my kid is not getting better. I'm not so sure. How could I encourage the pediatrician to call the APAL line, or is that a time to call the APAL line? What would I do if I feel like they might not be getting enough?
Yeah, I think that would be a great first step. I think that's a perfect time to do it. I think just starting with like, hey, have you heard of APAL? I heard about it and it sounds cool. You get to talk to a child and adolescent psychiatrist directly, and maybe we can just see if there's anything else we can do to help my kid right now, and either giving the pediatrician our phone number or our website, just so that they could learn more. We're definitely trying to spread the word as much as possible. So I'm hoping that your pediatrician will say, yes, we've heard of you already, but even just kind of giving that prompt to look into us, I think would be really helpful as a next step.
And it's mainly for providers, clinicians, right? So parents cannot call this line for their
Correct.
kid, right? Okay.
Correct. At this point in time, we hope to expand services and options, but right now it's mostly geared toward providers.
Right. And I think this is one of three states, I think, that does not have a line like this. All the other states have this kind of a line.
Correct. So right now, there's actually a national network of these CPAP programs, and if you look at their map, I think there's only one state now that's missing, actually. So we're getting really close. Not all states have full state coverage. There's a couple states that have like more partial coverage, but absolutely, we're like kind of in the last three to get here.
Right. And just because I mentioned it in the beginning, how does APAL fit into the pediatric mental health care access program that we're building?
Yeah, so it's one of the organizations that's part of the whole program that's all really focused on like how can we make health care the best for kids and teenagers in Arizona. So that's going to be through increasing access, like through our child psychiatry access line. That's also going to be advocacy, which is a big part of our program, as well as like how can we get these things onto the radar of the state government, and really just working as a team, because I think all of us in the mental health care field, in the primary care field, we really want the same thing. Like we really want the best mental health care for the kids and teens that we are seeing. And so we know we can do that the best by working together and kind of pooling our resources to make that happen.
So definitely the primary component of the pediatric mental health care access program is to have this call line, the APAL, on board so that primary care providers throughout the state can really access expert recommendations, advice, and support. And then another aspect of it is the educational component, which I'm working on, which is to really help find psychiatrists and mental health care experts to provide educational opportunities for primary care providers throughout the state. So we are doing that once a month, and we are aiming to do that twice a month. And if you apply live to attend, then you will also get continuing medical education credits, which is a bonus if you need them for yourself. So definitely, if you are a medical provider listening to this, please do consider joining us. And you can find that information on the AZAAP website, which is the pediatric website for Arizona.
Absolutely. And these talks have been super high quality. I've attended all of them and they've really been excellent and not, they're really not surface level, like they're getting deeper in terms of what pediatricians and primary care providers need to know. So highly recommend.
Awesome. So, is there any other way that listeners can get in touch with you? What is the website for APAL?
Yes. So APAL, APAL.arizona.edu. That will take you to both our pediatric and our perinatal psychiatry access lines. We also have an email that you can reach out to us at, which is team@apal.arizona.edu.
Awesome. So, typically I end with a couple rapid fire questions if you have a minute. Are you good with that?
Yeah, definitely.
Yeah? Okay, awesome. Um, what are the top three things you wish you knew before you became a child psychiatrist?
Oh, it will be really challenging, but also worth it. Take advantage of every opportunity you have to learn family therapy. That is like one of my most used skills.
Yeah, totally.
Also, I'm a mom to a 3-year-old, and I think just since becoming a parent, I've learned so much that's helped me in my role as a child and adolescent psychiatrist. So I wish I could have had all that parenting knowledge earlier in my career, but it's been so helpful.
What is the best advice that you've ever been given?
Yeah, I think, it said a lot, but just making sure that in order to be the best caregiver of others, that you're taking care of yourself. And I think that really applies to all doctors and mental health care providers, but also, to patients. I tell them about that too, because I see a lot of my teenagers trying to take care of their friends before they're doing stuff for themselves. And so
Mhm.
important for everyone.
Yes, I think that that in itself, like helping teens who are supporting the mental health care of their peers, I think it's a big area that needs some improvement because it's so many teens are being affected by that
Huge.
alone. What is something that you really had to think through?
Yeah, that's so tough. I feel like it's like every day. And so I try to like think out loud as much as I can when I'm seeing patients and their families so that we're really like making these decisions together. Like I'm providing them with the education and my recommendations, but I really want it to be a collaborative thinking session so that they really feel like they had a part in their treatment and that it's the treatment plan that makes the most sense for them.
Absolutely. Sometimes I feel like it's a stream of consciousness. I'm like, okay, these are, we can do A, B, C, D, F, G. And then I read their expression, like, okay, let's just focus on A and B. Let's go into depth, but I'm thinking all the way to Z. So, but I agree. I think the goal of that is to really help them know that it's not you making a decision, it's us making a decision together. Um, so the next couple things, if you can just finish the sentence, the
Okay.
the most important thing in life is
Relationships, family, friends, patients.
the most rewarding thing about being a child psychiatrist is.
Seeing my patients meet their goals, whatever those are.
I wish my struggling patients knew that.
They're not alone in this and it's temporary.
And finally, the future of mental health care will be
Access to mental health care for everyone.
awesome. Dr. Jacqueline Eskew, thank you so, so much for your time, co-director of APAL. I appreciate all of the information you've shared with us, and I think it'll really help empower a lot of people throughout the state.
Well, thank you so much for having me. It was really fun. I appreciate it.